Do you often feel an overwhelming emptiness or loneliness even when surrounded by people, and you find it hard to engage in conversations, or feel constantly entangled in something while your mind remains persistently sad for no apparent reason? Or maybe you struggle to focus on tasks, feeling drained and fatigued all the time. If these issues resonate with you, this video is made for you. Hello everyone, my name is Dr. Syeda Qadri, and I am a U.S. Board-Certified Psychiatrist, and I have been working in this field for the past 15 years and have seen thousands of patients. Today's video is going to be very important for you because today we will talk about a common but very important mental health illness called depression. Let's start and understand it well. Depression, also known as major depressive disorder or clinical depression, is a common but serious mood disorder. It affects how you think, feel, and behave, and can cause significant emotional and physical problems. Depression can affect people of all age groups, races, ethnicities, and genders. Females are more likely to experience depression compared to males, but men can also be depressed. Because men are less likely to recognize, talk about, and seek help for their feelings or emotional problems, their depression symptoms are more likely to be undiagnosed or undertreated. Now let's look at what the common symptoms of depression are and how you can recognize them. Symptom 1. Persistent sad, anxious, or empty mood. This means you continuously feel sadness, anxiety, or emptiness. This feeling always stays with you and often keeps you restless and sad. Symptom 2. Loss of interest or pleasure in hobbies and activities. Means you no longer feel interested in your favorite hobbies and activities. The things that used to make you happy no longer bring you joy. Symptom 3. Changes in appetite and sleep changes. This means your hunger either significantly decreases or increases. Additionally, you might experience unusual changes in your sleep patterns, causing you to either sleep much less or have excessive sleep. Symptom 4. Suicidal thoughts. This means you often have thoughts of suicide. These thoughts can be very intense and dangerous, which can compel you to take your own life. If you have such thoughts, you should seek professional help immediately. Symptom 5. Feelings of guilt, worthlessness, or helplessness. This means you feel guilty, worthless, and helpless. You think you are good for nothing and that nothing you do matters. I hope this gives you some idea of what the symptoms of depression are like. A full dedicated video on this topic is coming soon. You can check the description box for more detailed discussions on the symptoms of depression. If you like this video, please share it with your friends so they can benefit from it as well. Now let's see how depression affects the brain. First, let's look at biological differences. Depressed people show some physical changes in the brain, especially in the hippocampus, which controls memory and emotions. It can become smaller in cases of depression. Second, brain chemistry. Neurotransmitters like serotonin and dopamine, which help regulate mood, become imbalanced, negatively affecting mood and thinking. Third, hormonal changes. Pregnancy, thyroid problems, menopause, and other hormonal changes can trigger depression. Fourth, inherited traits. If someone in the family has depression, other members are also at risk. These genetic factors can also cause depression. These were some major reasons why depression can affect the brain and change your life. I hope you have understood it well. Please like and share the video with your friends and relatives. Let's take a look at some common types of depression. There are several types of depression, such as major depressive disorder, MDD, persistent depressive disorder, PDD, premenstrual dysphoric disorder, PMDD, postpartum depression, seasonal affective disorder, SAD, and atypical depression. Each type is very important in itself. We will understand these types in detail in upcoming videos. Now let's discuss the last and most important point. I know you have been eagerly waiting for this, so now I will tell you how to treat depression. First, we have medications. Antidepressants are commonly used to treat depression. They help balance the chemicals in the brain. Medication should always be taken under a doctor's advice. Second, psychological treatment. These treatments teach new ways to think, cope, and relate to others. They are conducted through talk therapy with professionals or supervised therapists. such as behavioral activation, cognitive behavioral therapy, interpersonal psychotherapy, and problem-solving therapy. Third, brain stimulation therapies. If medication does not reduce depression symptoms, and you do not want to take medication or cannot take it for any reason, brain stimulation therapy can be a good option. Many types of brain stimulation therapies are available, some of which are FDA approved for treating depression. For example, electroconvulsive therapy, ECT, repetitive transcranial magnetic stimulation, RTMS, vagus nerve stimulation, VNS, deep brain stimulation, DBS. ECT and RTMS are the most widely used brain stimulation therapies. We will understand these in more detail in upcoming videos, so subscribe to our channel and like the video. I hope this video gave you an overview of depression. If you want to know more, please let us know in the comments so we can address your problem. Remember, if anyone is struggling with depression, it is important to seek professional help. Thank you.